I'm Catherine, I'm one of the paediatric diabetes specialist nurses at Hillingdon. Obviously it's a huge shock when you first get the diagnosis. Lots of people won't know anyone else with type 1 diabetes, so it's not something they're expecting at all. Once you've had your diagnosis in A&E, you'll be transferred down to the children's ward where you'll start to meet some of the different members of the team. We've got consultants, a few nurses, we've got dietitians, psychologists.
Hi Alfie, I'm Jay. We met up in the ED. Come back to sort of spend a few minutes to try to help you understand type 1 diabetes. Now, type 1 diabetes, what happens in type 1 diabetes? You eat carbohydrate, glucose gets to the outside of the cell, but for reasons we don't understand, your pancreas stops making insulin. So you stop making insulin, your glucose then reaches the cell but cannot get inside. Okay, so what happens is your cell doesn't make energy. So what Alfie would feel, that he would feel tired, okay? And that's one of the T's of diabetes, you feel tired.
The four common, we call them the 4 T's, are passing lots of urine, so going to the toilet more, being very thirsty, losing weight, so thinness, and being very tired.
I'm Alfie, I'm 12 years of age and I was first diagnosed with type 1 diabetes when I was 11. When I got diagnosed, I was more in shock than anything because I'd been on holiday for about 3 weeks in Spain and I didn't think anything was wrong because my parents kept telling me that I was just me growing and slimming down a bit, but when I kept drinking too much and I just couldn't stop going to the toilet, it hit me that I knew something was wrong.
When Alfie was first diagnosed, I felt devastated, absolutely devastated. I felt like it was our fault. I couldn't understand why it had happened. It was just, it was awful. Just couldn't see it getting better.
One of the main worries that families quite often have is what's caused the type 1 diabetes. It's really important to understand that type 1 diabetes isn't caused by anything that you've done. It's not caused by your diet in the past, by eating sweets, by exercise you have or haven't done. You couldn't change this diagnosis.
Now what do? So we're now giving insulin, which is the key, as injections. Insulin then pushes glucose into the cell. You get your energy back, you stop breaking down fat, you stop weighing out that much, you put on your normal weight again, and you live a healthy life. Now this will need a lot of planning. Life is going to change. It is how you fit it into your lifestyle. So we're here to support you, to help you think like a pancreas and manage his blood glucoses between 4 and 7.
Whilst you're on the ward, you'll meet the different members of the team, and what we're aiming to do is to teach you to manage your own diabetes safely at home and to feel confident in doing that. So if you take the pen off me, so the first thing we want to do is make sure that the pen's working. If you hold the pen straight up in the air and push the bottom of the pen. During your admission, we're going to be giving you lots of information about how to manage your diabetes safely, and we understand that is so overwhelming, so we're going to go at your pace. If you have any questions, you stop us, you slow us down, and we can go over things again and again until you feel confident. We're not going to discharge you from hospital until you feel ready to, and even once you're discharged, we're going to be at the end of a phone anytime that you need us. Count slowly to 10.
So, 2, 3, 4, 5.
Having the diabetes team around you, what we're aiming to do is try and reassure you of all of the common worries that come with a new diagnosis.
I'm Debbie, I'm the dietitian on the team. I'm going to be spending some time with you today teaching you to carbohydrate count. That way you can adjust your insulin doses according to the food that you want to eat. So what we've got is this book. This is the Carbs and Cows book. Okay? And the book is what we use to carbohydrate count. So for example, do you like to eat chips? Now you could just look at the plate and you could say, well, I think my portion of chips looks like this one. But to know that you're looking at the right plate, you need to use a set of scales. What I suggest to parents is the more you weigh and measure when you're at home, the more accurate you are with doing guesses when you go out. If you didn't want to carry this around, it's available on the phone as an app.
After Alfie was diagnosed, we found out that there was a girl called Ashley at his school that also had just been diagnosed. When Ashley came to visit him, he just felt so relieved that somebody else who was in the same position as him took time out of her day to come and see him.
When I first met Alfie, I was kind of like relieved in a way because I knew that I wasn't alone, and even though he was diagnosed a couple of weeks later than me, we still learn from each other.
It makes me feel relieved because just knowing that someone's there to cheer me up when I'm having ups and downs, or just get along well and just clear my mind of everything.
When we were told that we were going to be discharged with Alfie, we were really terrified. We weren't sure how we'd manage on our own at home.
So having Debbie, the dietitian, visit us at home was really useful. She came in and we looked at Alfie's favourite foods, and we were able to look at the things that I found difficult to count, and also the foods that Alfie might have when he's out with his friends.
One of the things that really helped us was a 24-hour helpline, especially the first few weeks of Alfie's levels up and down. We couldn't control his insulin. It was a big help for us to know that we could just contact anybody and they'd be straight on the phone and answer us straight away all the questions and reassure us not to worry too much.
Having type 1 diabetes doesn't need to stop you doing all the things that you love in your life. As a team, we'll support you to fit type 1 diabetes into your life so you're in control of it rather than it being in control of you.
It's been a good year or so since I was diagnosed, and from looking back from how unwell I was to now, it's actually made me think that it's a positive, not a negative. It's made me more aware of keeping myself healthy and just living like a normal person instead of having to worry every second or so.
Living with type 1 diabetes with the support you get from the diabetes team is manageable. Hang on in there and we'll get through it all.
My advice for anyone newly diagnosed would be to just stay calm, because at the end of the day, you're always going to get through it, without a doubt.